Dr. Avery Hinds. I'm a medical epidemiologist and I am one of the advisors on the Scientific and Research Committee of the TTMA, the Trinidad and Tobago Medical Association.
Okay, so the novel coronavirus, that is what the general population knows it as. It's very new, and there is definitely a lot of uncertainty, a lot of misinformation. So maybe we could start with the facts. What do we know about this particular virus so far?
So what we know is that a new strain of an old virus has begun to circulate in the human population. When a new strain of a virus appears in the human population, there's always concern, and that's because new viruses are viruses to which the entire population has no immunity, and therefore they can spread very widely and very quickly to a large number of people across the globe. And when a virus does that, it's called a pandemic. Now, this virus hasn't quite reached pandemic status, but it is definitely an epidemic. It's an outbreak of a new virus, and it is largely contained within mainland China. But because of international travel, there have been several cases that have popped up in other places in the world, 24 other countries to be exact. And this is cause for concern because the ability of human beings to move from one country to another means that they can carry pathogens with them. Therefore, there has been an alert sent out to allow all of the health systems in countries around the world to prepare, to look out, to be aware that there's a new viral entity, and to set their systems up to test, to isolate, to contain, and in that way to prevent rapid spread from person to person. So really only in mainland China and perhaps a couple other Asian countries is there person-to-person spread. In the other countries, there was an importation followed by isolation and halting of that chain of spread. That's what's been happening across the other countries to date. Now, as happened with influenza H1N1, the pandemic strain in 2009, eventually there is the possibility that the health systems can't keep track of every single person. And if that happens down the road, the ability of both the health systems and the population to adapt behavior to suit becomes important. And really the more important bit is the population's response to respiratory illness. Now, the response to respiratory illness is something that we've been hearing about ever since pandemic flu and before, and it focuses around hygiene. It focuses around hand hygiene, I'll explain why in a moment, that's washing your hands, and around respiratory hygiene or respiratory etiquette containing coughs and sneezes. Also around responsible behavior. Responsible behavior entailing keeping ill persons away from public places where they can spread pathogens. Let's go back to hand washing. Hand washing is considered important not because viruses penetrate the skin of your hand and get into your bloodstream, but because your hand goes to your face frequently, wiping eyes, adjusting glasses, doing things that basically bring pathogens to your mucous membranes. And when you do that, you give the germs access to a portal into your immune system. And the ability of the germs to get through mucous membranes is reasonably good. Yeah. So we have to make sure we don't give them a boost. And that's what the hand washing is really about. So when you are out and about, you don't really know what germs are on the surfaces that you touch, on other hands that you shake, etc. And that brings us to another point, the respiratory hygiene. When we were little, well, when I was little, that was a while back, we were taught that you cough and sneeze into your hand. But we've been able to revise that because when you cough and sneeze into your hand and you don't wash it, you have a hand full of droplets filled with viruses and bacteria, pathogens in general. And when you shake hands with someone else or touch a surface, you leave those either on someone's hand or on a surface to be picked up by other persons. So the respiratory hygiene mechanism that we now advocate is that you cough or sneeze into the crook of your elbow like this, and in so doing you don't spew respiratory droplets. And that's important because most respiratory illnesses are transmitted in the droplets that come out of your respiratory system when you speak, cough, sneeze, etc. Even breathe without doing anything else. You are releasing respiratory droplets. So that bit of hygiene then takes us on to another component, which is keeping shared surfaces clean. Because we have no guarantee what anybody else is doing with their hands, we would like to encourage places where we know that there are shared surfaces at workplaces and kitchens, anywhere that they on doorknobs, counters, keyboards, telephones, things that people share within a communal space. We want to advocate that there is enhanced cleaning, disinfection of those surfaces and objects. And there's nothing fancy that's required. Most of the household cleaning agents will work, dilute bleach will work, and many of the commercial cleaners will also work. Alcohol at 70% and above is a good cleaner. If there's nothing else available, you can always rely on that, but it has to be 70% and above for certain. So keeping surfaces and shared objects clean is another way of slowing the potential spread of droplet transmitted pathogens such as coronavirus, such as influenza. And while we're paying a lot of attention to the threat of coronavirus, there's a bigger and more imminent threat of the influenza virus that circulates every year. After Carnival in particular, there's a spike in respiratory illness. I'm sure we all know that after Carnival, everybody comes down with some bug, and they name the bug. They name it after the most popular calypso, the most prominent event, and it's a thing we do in Trinidad. But that's usually one of the respiratory viruses, most commonly influenza. And that feeling of feeling very ill, mash up, as we like to say in Trinidad, is one of the indications that you have something a little more serious than just the common cold. So the spread of respiratory viruses is not limited to the new coronavirus, and the warnings, the advice that we're giving is not just for coronavirus, but it's also to reduce the spread of the more common things, the things that actually kill thousands of people every year. Influenza around the world kills thousands of people. And because it's easy to transmit, easy to spread, we need to make sure that we reduce the possibility of that by taking all the hygiene precautions that have been put on social media, put out from the Ministries of Health, from the Pan American Health Organization, from the World Health Organization. So that's sort of the main thrust. The thrust is informing the public of what they need to do not to spread illness. Another issue is the habit of persons with respiratory illness to come to work if they don't feel too bad. It's not really about how you feel, it's about whether you're contagious. So when you come to work with your sniffles and your cough, you are putting the rest of the workplace at risk. So to school, when you send your child to school with coughs and sniffles, then you're putting the rest of the class and the rest of the school by extension at increased risk. We're going to need to be a lot more circumspect with those behaviors in light of the potential for a new virus to be introduced quietly. If we are circumspect throughout, across the board, regardless of whether we think it's the new virus or not, then we are automatically reducing the ability of anything to spread through the population. So the emphasis on social distancing, as we call it, the practice of not putting yourself into public spaces with your respiratory illness, is something that we also do want to underscore. And along with that, if you do have to go out, then this is where things like masks and keeping a certain distance, a 2 meter or 6 foot distance from other persons, then becomes applicable. The masks that you see the persons on the streets of China wearing aren't to prevent them from getting what's floating in the air. That's not how it works, but it is a mechanism of reducing droplet spread from persons. And the population there, having gone through several iterations of respiratory outbreaks, is usually quite quick to don the masks and to prevent additional spread to the extent that each individual can. So it's really a communal effort attempting to prevent spread of illness. What we do find here is that people seem to think that walking around with a mask on your face is going to protect you. It's really not. And the reason it's not is because the kind of mask that will be protective is not the mask that is generally available. And the best place for the use of the kind of mask that is protective is within the healthcare system, where the contact with ill persons is most likely. That kind of mask is called an N95 mask, and it's actually fairly difficult to breathe through for prolonged periods of time. So what you find, and what you've seen in past outbreaks, especially with pandemic flu, was people who manage to get their hands on N95 masks, then wearing them on their foreheads, which is completely pointless. Also, the fact that you have been wearing a mask and then you take it off and you don't wash your hands means that whatever has been trapped on your mask is now on your hands for transmission, either to yourself by rubbing your eyes, your mouth, your face, or to another person. So the mask use that the healthcare professionals engage in is followed by a lot of hygiene precaution behavior. Mask use is followed by hand sanitization before and after putting on the mask, so too gloves. So the improper use of masks and gloves can actually put people at a greater risk because they don't take as much time to practice the hygiene precautions. So we don't really advocate for gloves and masks in the public. We do advocate for hand hygiene, social distancing, and just the respiratory etiquette of not spreading your coughs and sneezes. The ideal thing for respiratory etiquette is that you use tissue, disposable tissue, you cough into that, suppress the expulsion of a cloud of germs, and then you throw that away and wash your hands, and preferably your face, so that you don't have droplets on your face to transfer to anybody whom you get close to, give a hug or a kiss, that kind of thing. So these are the real approaches that are useful for the population to engage in. At the healthcare system level, they then engage in other things. They engage in screening. They look out for people who have relevant histories of travel or relevant symptoms. Anything that looks suspicious based on travel history or the way the patient presents, they will do testing. They will isolate the patient and make sure that they aren't the source of an outbreak within a healthcare institution. So there's going to be a lot of that, a lot of precautionary measures being taken, precautionary isolation until you identify this is not the new virus. A lot of that will be happening in the population. What we don't need is we don't need false alarms each time somebody is being tested and put through that precautionary cycle, because each time that happens, then we get a little more desensitized to when an actual event may occur. If we cry wolf every time we hear something, then when a real event may occur, people are going to just think it's another false alarm, another bit of false news. So the responsibility of the public not to share false information and unverified voice clips and videos, that's another responsibility that the public can take up in order to make sure that we have the correct information going through the various media channels, both traditional and social media, at the right time. So those are the main points. Those are the main things that I think we wanted to cover. The facts about the virus itself are not as important to the general public. The viral information on what type of coronavirus it is and what DNA it has, that's for the people in the labs to really worry about. What we can emphasize is that the coronavirus that is circulating now is a little bit similar to the one that caused the severe acute respiratory syndrome back in 2003 that also originated in China, and also bears some similarity with the one that arose in Saudi Arabia in 2012, and that one was called the Middle East coronavirus. And those were thought to come from different animal species and spill over into the human population. And when we have those spillover events where a virus learns how to spread from one person to another, those viruses are a little more what we call virulent. They cause a little more illness than the routine coronaviruses that have been in circulation for eons and that don't even have names. They just have numbers. And those are the ones that cause the routine coughs and colds that people get from time to time. Not the same sort of severe illness with the flu.
Yeah, I do have a question. I could imagine that you've heard a lot of myths floating around about this novel coronavirus. Would you care to perhaps debunk the biggest one that you've heard, whatever it may be, that's been floating around?
I've heard so many myths that I'm not even sure what the biggest one is right now. Is there a particular one that you want to address?
Well, I saw on social media one person was claiming that the death rate for this coronavirus is outpacing the recovery rate. But these statistics show a different story.
So I think that people are having a little bit of difficulty with some of the stats that are being presented. I remember having quite a detailed argument with one of my former school colleagues about that same topic. There are three sets of figures that are being bandied about. There's the total number of cases confirmed, that is laboratory confirmed cases, and that is somewhere in the vicinity of between 37 and 40,000 at this point in time. There is a death rate, that it's really a number of people that have died, and that is between 800 and 900. The figures vary depending on which source you're looking at. WHO's figures, I think, are 813 at this point in time. And then there is something that they call recovered. Now, recovered means out of the persons who were ill enough to be hospitalized, and that's not 100% of the people who were ill. It's about 25 to 30% or so. Out of the persons who were hospitalized, the number that then had a recovery as opposed to a fatality. That does not count the people who were not ill enough to be hospitalized. So that small number in between that they call recovery doesn't mean that the other people that weren't dead are still ill. That's not what that means, and I think people are getting confused by that. They're thinking if we haven't put them in the recovered category, that they're still ill. The maximum time that the virus seems to run through the system is maybe about a week and a half to 2 weeks. Most people seem to have resolution of their symptoms within a week. And those who are a little more ill and who have to go to the hospital may have symptomatology that takes them past that 1 week mark towards 2 weeks. The majority of people recover. So it's about 2% of the people who have been confirmed with the virus who then died. And that has been fairly consistent as the numbers have climbed. Total number of people and the total number of deaths has remained about proportionate around 2%. That recovered figure is really a figure counting hospitalized and then discharged alive. And I believe it's causing some confusion, and we may need to have a word with either the WHO or CDC or whoever is actually putting it out for them to make some clarification, because a lot of people seem to be confused by that.
Is there a particular group that should be particularly on alert for this virus?
So, the respiratory illnesses in general have a more serious course in certain people with pre-existing risk factors. One of the pre-existing risk factors is advanced age, and then any other what we call comorbidity or coexisting illness will then increase your risk. So if you are in the over 65 category and you have heart disease, or you have pre-existing lung disease, either from asthma or from smoking, being a chronic smoker, then you have what they call chronic obstructive pulmonary disease. These things put you at risk. The immune suppression that happens when you have diabetes, or immune suppression from being a transplant patient or having some of the other autoimmune diseases, those things also can put you at increased risk of having a more serious course of illness when a new virus presents itself and you happen to contract it. So those persons need to be on the lookout. Now, in general, the symptoms that people would have when they get this coronavirus are very similar to the flu: fever, cough, sore throat, body pain, malaise, plus or minus diarrhea and vomiting. It can happen, or it could not happen, and it doesn't mean that the diarrhea says yes you have it or it doesn't. It's one of those things that is a possibility but not required. And these symptoms usually run the course of a few days and then begin to abate. If you are becoming more and more dehydrated because you are unable to drink, you're vomiting a lot, that sort of thing, those are things that are indications that we need to go seek care. So an inability to keep down fluids for more than a day, go seek care. Any shortness of breath, difficulty in inhaling through your mouth, not your nose, because your nose can be stuffy, that's not shortness of breath. But when you open your mouth and you try to take a breath in, you still feel like you're not getting enough air, not getting enough oxygen, that's a sign that you should go seek care. And the persons with pre-existing illness should really look out for those things and seek care earlier rather than later. So those are the sorts of risk groups that we really want to advise to monitor their health closely. They are also the same risk groups that, for the purposes of influenza, we advocate that they go get vaccinated. There is an influenza vaccine, and that protects against the flu virus. There is as yet no vaccine for the coronavirus. They're working on that, but that's not yet available. So the vaccination that we're advocating is really to protect people from the other big thing, which is influenza. And that flu vaccine will not protect against coronavirus. It's not expected to, but it will reduce your risk of having a serious respiratory illness, because more than likely what's going to be in circulation immediately after Carnival is going to be the flu. So.
And final question, I'm sure you would have been following whatever developments the state would have taken to try to protect this country. Do you think anything else should be implemented, or are you satisfied with the measures taken so far?
The measures taken have really ticked all the boxes in terms of the systems that need to be prepared. The state has made sure to engage the reference laboratory for the region, that is the Caribbean Public Health Agency's disease laboratory, for testing of samples, so that if there is a case that meets the case definition, the sample will be sent there and a determination will be made of whether this is a new virus or any of the other respiratory things that are in circulation. The ability to isolate persons and to prevent the spread of illness in hospitals via the infection prevention and control protocols that have always been in place, that have always been taught to the health professionals and that are currently being reviewed, revised, and everybody's making sure they're familiar with how to prevent spread of droplet-borne infection so that there aren't slip-ups. That's on par. They have the technical assistance from the WHO in the region, that's the PAHO, Pan American Health Organization, and also from the Caribbean Public Health Agency. So those bits of advice that they may need, they are also getting from the sources of good technical info, and they have the ability to isolate ill persons both within the hospitals and at a special designated facility. So all the things that can be done within the limits of the health system's resources are being put in place, and between those activities and the responsible behavior of the public in not spreading the germs, we are likely to be able to manage, but we do have to not be complacent and be aware of whatever information is being put out. We have to keep our eyes on the media, keep our ears out, so that when we are told that we need to step up our precautionary measures, then we can do that in a timely fashion.
Thank you so much, sir, for speaking with us, and this information was indeed very, very helpful.
Welcome. Thank you.